Welcome to Rural Health Today. I'm JJ Hodshire, President and Chief Executive Officer of Hillsdale Hospital, and this is a podcast where we connect you, the listener, to what really matters the most in rural health. Well, I'm thrilled to be in the studio today with a very special guest, and I know I say all the time, very special guest, but today I mean this guy is at the heart of medicine. In his practice, in his clinical acumen, and in his business acumen. In fact, I have interviewed hundreds of thought leaders from throughout this country. I've had Supreme Court justices on this podcast. But when I reflect upon three visionaries in Michigan, three distinct and unique individuals come to my mind. Bob Riney, who's been on my podcast, Brian Peters, and Dr. Miller. And Dr. Miller, I have not had the chance to interview you. I've always wanted to. I have followed you in the work that you're doing. I have followed you on social media. You're everywhere, first of all, man. I mean, you're speaking to kids at a football camp the other day. You're just everywhere, and you're doing some great things. And I'm excited today to have you in the studio because as president, CEO, of Michigan Medicine, that's a huge responsibility. One of the largest centers here in Michigan, and executive vice president for medical affairs at the University of Michigan. And that relationship we'll talk about in just a minute, between the two. But it's great to have you in the studio. One of, I believe one of the most brilliant minds in medicine. And I say that I have no reason to say that other than out of the truest form of saying that you are a remarkable leader. And I am so excited to have this conversation today. So let's start with our listeners who may not know you. They've obviously heard of Michigan Medicine. They've heard of the University of Michigan. But tell us a little bit, Dr. Miller, about your role as the CEO of Michigan Medicine. And then, the relationship that plays to as the Executive Vice President of Medical Affairs for the U of M. How long you've been there? What led you to medicine? Take us through the journey, if you would.
JJ, thank you for the extremely kind introduction. It means a lot. And thank you for your extraordinary leadership in healthcare, and it's a privilege and an honor to join you today. And I've been a faculty at the University of Michigan for 18 years, actually, 18 years to this month.
Wow.
And I joined the faculty as a clinician, as a urologic cancer surgeon, working to build a clinical practice and research programs focused on taking better care of patients with urologic cancers. I wanted to make a positive impact in the lives of patients with prostate cancer, bladder cancer, kidney cancer, and do that through a combination of clinical care, research, and education. And I've been incredibly fortunate and grateful to be a member of the faculty at U of M for 18 years. It's probably, JJ, through some combination of serendipity and planning that over the last 10 years, I've had the good fortune and opportunity to contribute through different leadership roles. And that includes serving for nearly 5 years as the president of the clinical enterprise for the University of Michigan's Academic Medical Center. So think of all of our clinical sites and programs in Southeast Michigan, from Northville to our partnerships with Trinity and Chelsea and up to Brighton. And then for the last year, I've been CEO for Michigan Medicine and EVPMA for University of Michigan. And the responsibility there really then starts to include our full statewide network, our partners at University of Michigan Health Sparrow and University of Michigan Health West, as well as the now more than 175-year University of Michigan Medical School. And so kind of really encompassing all three missions of the academic health system: clinical care, education, and research. And I'm grateful to be a member of the team at Michigan and to have the opportunity to try to improve lives and improve health through these roles.
Yeah, you're definitely doing that. In fact, I literally, right before this meeting, I was in a meeting with my urologist, Dr. Eric Stockel, and I said, Doc, I got to leave, and I'm interviewing Dr. Miller. He goes, who? I said, Dr. Miller. He goes, the Dr. Miller? I'm like, yeah, the Dr. Miller. And he tells me some stories, and the stories all ring true about the amazing leadership that you have provided to this system. And it's done out of passion and care for patients. And I think that's at the heart of the man that I know and have had the opportunity and privilege to get to know as serving on the Michigan Hospital Association. So it's great to know your background. One of the things we like to do is humanize our guest with our listeners, because we have them listening throughout the country, and you're a real person. Yeah, you're this, great leader, and you have a lot of responsibility and a tremendous amount of people that report up to you. But humanize us a little bit, right? So tell us an interesting or fun fact about yourself.
Well, thanks, JJ. Please give my best to Dr. Stockel. I grew up in Midland, and I'm actually right now at my parents' where my parents still spend their summers in northern Michigan. So my dad was an endocrinologist in Midland. I really say kind of a doctor's doc. He practiced in the community for more than 35 years. My mom was an educator. I have an older brother who lives in Charlotte, North Carolina with his family, and a little sister who lives in Portland, Oregon. The most important thing and the best thing I can say about myself, JJ, is that I've been fortunate enough to be married to my wife, Inga, for nearly 30 years now. We live in Ann Arbor. We have 2 daughters.
Wow.
The oldest lives in New York City. Our middle child is a senior at Michigan, and our youngest child will be a sophomore in high school. But the most popular member of our family is Wilson, our golden retriever. And to tell you what we spend our time with, a big part of our life is sports, and in particular tennis. We play and watch a lot of tennis, and a lot of U of M athletic events. Yeah. And so for me, the in the quieter moments, taking Wilson for long walks and spending time with our family around a bonfire in the backyard, those are some of the ways that we catch up as a family. And so that I would say is probably the biggest, most important part of my life, JJ. So thanks for asking.
Absolutely. And nothing humanizes you more than a nice dog and a great story. Now, if I remember, your daughter was a star tennis player, correct? I mean, she did very well, didn't she, in the state?
Yeah, thank you. I have two daughters, both of whom play tennis, and we're both fortunate to play for University of Michigan. They can both easily beat me, and they've enjoyed it, and they've enjoyed it and have worked hard at it over the years. But yeah, so I have to say, our dog's name Wilson. That is, of course, after the tennis ball. So you can see how
That's incredible.
How close tennis is to our family.
That's right. Well, it sounds like a fun and certainly enlightening time at your house when you can get away to your parents' cottage there in Midland, Michigan, not too far. Folks know that can be rural parts of Midland. And so we're here to talk about all things rural today and how the relationship plays. And so we're going to be talking about coordinating the goals and success across healthcare management, collaborations, and patient care. Dr. Miller here to share his expertise on leading a major healthcare organization to improve quality and patient experience. We'll talk about measuring success, national advocacy, and of course, what all this has to do with rural health. So why don't we get into a little bit about, the mission of Michigan Medicine and talk a little bit to us about, the advancing care that you're doing in Michigan. How do you build these strategies around that specific mission? And how do you measure those successes?
Thanks, JJ. And I really appreciate you starting by the concept of mission, because healthcare is a complex business, as you know so well, and it is increasingly technologically focused, often in moments of uncertainty for our patients and families, but it's fundamentally human and mission driven. And I think that's something that we try to focus on at Michigan Medicine. And our mission of advancing health to serve Michigan and the world, I often break that down into different parts. I say that concept of advancing health is our commitment to continuous improvement in the work we do every day in those core areas that we all focus on, like access and safety and quality and experience for our patients and our teams. How are we constantly striving to have a bigger and more inviting front door to the services we provide? The second part of our mission of serving Michigan, to me, I believe as an academic medical center, we have an opportunity and a responsibility to partner across the state to find ways to extend services and capabilities to as many communities across the state as possible. It isn't about trying to take care of everyone in Ann Arbor. It is to really extend possibilities to impact wellness and well-being in communities. And then that final part of the mission of advancing health to serve Michigan and the world, I think there's a unique responsibility to support innovation. And that might be innovation in clinical care delivery or new research or innovation in workforce development programs, things that really focus on all aspects of our mission that improve the lives and health of our communities. And I think the question of how we measure success is a great one. And sometimes it can feel elusive, or you ask yourself, are we getting where we're trying to go? And I often say that we, with humility, that we want to be the most consequential academic health system in the world, and measured by concepts like the reach. Are we reaching the lives of many patients? Innovation and excellence, but importantly, trust. I think more than ever, trust in what we're trying to accomplish with our patients and our communities. And I think, JJ, to be very specific on your question, I often say that we have to measure success both with data and with stories. And I'll give you an example. We have, like many organizations, done a lot of work with our contact center, that front door to your organization where patients call if they have a concern or they need an appointment. And much credit to our teams, we've made a lot of progress, but we were not where we wanted to be several years ago. And I would always say to our teams, and I know you see this, JJ, because you're in the community every day, I would say, I will know we're making progress when our measured performance in things like service level, handling time, abandonment rate start exceeding benchmarks. But I'll also know it in the stories in the community when I'm out at an event, and the first thing I hear is that it took a long time to get through our contact center. So measuring success with data and stories aligned with the mission is the goal that we're working toward.
Yeah, I think what's really incredible to note, and I shared this with Bob Riney last week when we were together, is, when I look at Henry Ford Health and I look at Michigan Medicine in the University of Michigan, not only are you uber focused on, what you do locally for your patient catchment, but also global leaders, in research, global leaders in trying to solve some of the most complex issues of our time. And, we are facing the tsunami of the federal government, the state government. We're facing challenges, as you well know, of payers and negotiating payer rates, and all of these forces come at us. But yet you have not, Dr. Miller, and your organization lost sight at all of what was most important and at the center of it, which was our patient, and how to advance medicine and care for those around us. And one of the things that really has been intriguing to me is following you in what you recently opened in 2025, and that is a Ypsilanti Health Center for high complex inpatient care. And I'm most interested to learn a little bit, as you talk about focusing on some of those high acuity cases. Number one, what motivated this project, and what is the success of it? How are you even measuring those successes? And can you share a little bit about that initiative, because that's really a sweet spot for you?
Yeah, thanks, JJ. And again, I would say that, moving in the direction of our mission, acknowledging that we are an imperfect organization, but striving to get better, is an important part of defining not only your operations, but your strategic investments. And the renovated Ypsilanti Health Center really reflected a reality that we faced, that we were not consistently meeting the needs of our community that we serve, both in terms of, the fundamentals of patient access and experience, but also community partnership. And so we were very pleased and proud to open the renovated Ypsilanti Health Center in 2025. And how do you measure success there? Well, we think that, access, right? We've seen more than 50,000 primary and specialty patients for specialty and primary care visits. We knew that imaging access was limited. Patients who were seen in our prior Ypsilanti Health Center clinic had to travel to distributed sites for imaging. We've been able to make that more easily available and have performed more than 18,000 imaging exams. And importantly, the patient experience with that has been excellent. We've seen it, above the 95th percentile. And I think expanded services that are really needed in the community, JJ, and I would highlight our child and adolescent partial hospitalization program that's now available in Ypsilanti. I mean, as we both know, behavioral health is not, the needs are extensive, the access is limited, and we've been able to serve, in particular, a patient population in child and adolescent behavioral health that had particularly acute access challenges. And so we've really focused on bringing clinical services to the community. But JJ, you mentioned earlier that health is not just health care, and it is connecting in areas like transportation, community engagement, food insecurity. And so at the Ypsilanti Health Center, our Maggie's Marketplace, which is a a source of nourishing food for community members, where we've supported more than 180 households and 430 individuals each month. So the Ypsilanti Health Center is a reflection of our commitment to better partnership, of listening to members of our communities and saying, where are we, where have we been falling short? How do we improve and how do we engage? And it's a story that we're proud of and one that we're continuing to work on because, as I said, our mission of advancing health, that concept of continuous improvement, we have more work to do, but we're making progress.
Yeah, and certainly what you have been able to do in Michigan medicine is really to look at the social determinants of health and to strip out in each of those areas what you can do to improve the quality of living, which does obviously play a significant role in the health and wellness of the patient if they do not have access to medications, nutritional food. And you're addressing those issues in these communities that need it the most. And you're the leader in this area. And when we think about engaging communities, we hear these words, collaboration and partnerships. But if there's anyone who knows how to do it, it's you, Dr. Miller, and Michigan Medicine. I've read a tremendous amount as I prepare for my podcast about the work that you've done in across the entire state of Michigan and, of course, even the nation. But, I guess talk to me about your business acumen and even clinical acumen, about how you approach those relationships for collaborations and partnerships, and in the spirit of access of care for Michiganders.
Yeah, thanks, JJ. And I think your comment on community engagement, I think it always starts with asking, curiosity, humility, understanding what the needs of the communities we're trying to serve are. It isn't a kind of we know the answers coming in. It's really seeking to understand it. And in many ways, viewing an academic medical center like Michigan Medicine as one partner in a statewide ecosystem with the goal of helping every community in Michigan thrive. And that may sound like a fairly high level aspiration, but you can tie specific initiatives into that. And I think if I could offer some ways we've tried to do that through collaboration and partnership, I'd start with what I call our fully integrated network, which includes U of M Health Sparrow in Mid-Michigan and U of M Health West, where we've really focused on the concept of providing the right care in the right place at the right time. And so take, for example, the 4 community hospitals that were part of Sparrow Health System, now U of M Health Sparrow, in Clinton, Ionia, Eaton, and Carson City. I mean, these are hospitals that have been built and supported by the communities, where we've sought to provide complementary services to support the excellent care already occurring in the community by supporting the addition of some gaps in services locally and some support from the academic medical center that we think is allowing more patients to get care in their communities. And I'm happy to share more details on that. But I also think there are important partnerships that represent points of connectivity between different systems. So in Southeast Michigan, we've worked hard with Trinity, for instance, to find areas where we can meet the community need through assets that are already existing in our system. So we've partnered at Chelsea Hospital, as you know, with a joint venture where we've been able to expand access to inpatient rehabilitation and services for some medical and surgical patients. In Oakland County, we asked the question, how can we partner in pediatrics to improve subspecialty access rather than finding just the right level of service access to meet the community needs? We also have looked outside of more traditional healthcare systems, JJ, and I'll give you an example. Packard Health is a federally qualified health center in Washtenaw County that really provides extraordinary primary care, behavioral health care in the community. And we have, like many large systems, had difficulties at some points with primary care access. And we've been able to partner with Packard Health, for instance, when we have patients who present to our emergency department in need of long-term primary care, to offer that in a timely fashion, in a way that's really better meeting the needs of the community. So these are examples of both within our kind of fully integrated system, with other health systems, with some community-based partners, to really kind of meet the needs of communities, starting with the concept of curiosity and humility and understanding what the community's needs are. Because again, I'll come back to that concept of being a partner in a statewide ecosystem and seeing that as really a mission-driven goal.
It sure is. What is very striking to me is when I joined the Michigan Hospital Association board that you also serve on, is sitting around the table. We're all competitors to a certain extent, and yet we come together, for collaborative exercises, for collaboration in programs, sharing resources, and it's how it should really work. And you have set the example of that in these type of programs. And unfortunately, as we transition this conversation, in the nation, competitors and people of different opinions are taking on a different approach lately. And I'm reminded of a biblical phrase that's very important to me in my journey, and it was very pointed. For such a time as this, and it was a reference about saving a nation, and it called a specific person to rise up, and it gave her a charge to save a generation. And I think if there's ever been a phrase that we can take and ever run with, it's for such a time as this, we have been called to stand up and to lead. And I think as I reflect upon a carriage ride several years ago, back from a dinner with Brian Peters, the MHA president, I was very discouraged. I was very discouraged at what was happening in the national scene. And he looked right at me, as Brian does, and, stoic, and he said, listen, history is going to judge us, and we're on the right side of history. Continue to speak up, continue to be the voice, and it, as simple as that was, it was really, I was awestruck by the reality of, you know what? We are on the right side of history. I know we are. I'm convinced we are. Even when my own party does very bad things to hurt healthcare, we have to stand up and we have to speak out. And so what we know right now across this nation is that advocacy is taking on a different flavor. Politicians get up today and name call. And we're told that we're full of waste, fraud, and abuse when we know we're not. We are told that our inefficiencies are waste, and we see every day the impact of lack of healthcare resources in our communities as we go to the grocery stores, as we go and visit, those that we take care of in the community, and we hear their stories. And these are real stories. It's not fraud. It's not abuse. It's not waste. It's my pastor friend who I know well who's on Medicaid, and that he's not the face of abuse. We're talking about those who need it the most. I'm a product of Medicaid. Having grown up in a family of 7, I know what the impact of Medicaid is. All of that to say, advocacy has taken on a different flavor today. We heard from Rick Pollack recently, who talked about Washington is transactional in nature, that human touch is gone, that relationship building is gone. It's all transactional. I firmly believe that. But you're an advocate. Dr. Miller, you speak up and you speak out, and you do so boldly, and I'm very proud of you. You just did recently in some negotiations, which we won't talk about, in some insurance negotiations, but you did what was right for the patient. And you were bold, and you looked at us and you looked at me and you said, we're doing this for the right reason. You may hear some things in media that aren't true. You may believe some things that you hear, but here's what we're doing. We're doing it for the patient. And I firmly believe you have done that on a national scene. So I want to ask you then, for all of our listeners across the country who are maybe new to healthcare and who are trying to figure out their way of advocacy from rural hospitals to major systems, how should healthcare leaders engage in state or national advocacy efforts to advance health and improve access of care? Give us some strategies, if you would.
Thanks, JJ. And I think that both the complexity and the thoughtfulness of your question reflects your commitment that I've seen to healthcare delivery, and it's laudable, and I find it inspiring as well. And I share your view. I often say that, and oftentimes healthcare is defined as a hospital, but I often say our care delivery systems are 24/7, 365 forever. We are here always to meet the needs of our patients. And if we keep that at the center, right, keep the concept of caring for patients and doing the right thing at the center of what we do, then there is a realistic optimism for what is in front of us, right? And we see that in the big moments and the small moments in healthcare. And so that is our guiding framework, is grounding, and it's reflective of your conversation with Brian. But I do think there are specific areas that we have to be intentional in talking about. And advocacy to tell the story of the community benefit and impact of hospitals. Not just measuring that in dollars and cents in some way, but measuring that in programs that are improving the lives of patients because they enhance transportation.
Right.
Or they create, for instance, like our U of M Health Sparrow Eaton, where this Alive program has created a health and wellness center that not only allows access to clinical services, but to nutrition, to other wellness strategies, to diet and exercise opportunities. These are real and meaningful services that we have to start by telling that important story. And then when we pivot to advocacy, I think it's important that we not try to not acknowledge the challenges that exist, right? This concept of affordability in my mind is a real one, right? I was at our dentist and I was leaving the dentist's office and the hygienist who had been working with me indicated I'm going to my, to a second job now because my insurance premiums are so high. And so, but I think in healthcare, it's important that we really intentionally and clearly talk about affordability through the lens of value, right? That each dollar invested in healthcare, which is an important dollar invested in better lives and economic progress, that we measure and understand the value of that in terms of improvements in health, in terms of making sure that we're appropriately utilizing different services. So we have an accountability in this. And with those data and that sense of accountability, we'll be able to tell not only our story of community benefit, but demonstrate that these concepts of waste, fraud, and abuse are actually not telling the story of what's happening in healthcare delivery. So we have to be visible in telling our story. We have to have data that acknowledges both the challenges and the opportunities in healthcare. We have to take responsibility for our part in these affordability conversations by ensuring that we're measuring and improving quality and thinking about areas like appropriateness. And then we have to keep patients at the center. If we do those things, then we have an important story to tell, but we can't sit back. We have to actually engage with elected officials. We have to engage with our communities. We have to encourage others to tell our story as well. That's an area, JJ, where I've seen you provide incredible leadership. And I think if we can multiply that across healthcare systems locally, across the state and nationally, we'll continuously restore, elevate, and drive forward the trust that ultimately sits at the heart of the clinical relationship. So I share the realistic optimism for the future while recognizing the challenges we have in front of us.
Yeah, and you've been a role model for that initiative, certainly here in the state of Michigan, in advancing health and wellness and being that voice. I often reflect upon some of the challenges we have faced most recently, and they're sobering in nature. And, when we think about what we have really learned over the last 10 years is that rural hospitals across this country are closing at exponential increases in rates. And we witnessed 170 closures since 2010. I just had Scott Becker from Becker's Healthcare on the podcast, and he was sharing the work that they've done. 734 hospitals at risk of closing in this country. And half of those are at immediate risk. And we know all the reasons why that you've just talked about, and the need to advocate has never been as real as it is today for us to take a stand. And I think that's very important. I want to make a shift here, though, because 170 of those hospitals are rural hospitals. Okay? When you look at the number of hospitals on the closure list, we're not talking about big tertiary centers. These are rural hospitals in rural America, the economic engines of their communities, sometimes the largest, if not the second largest employer in their community. I would also submit to you, and I think you would agree, the answer isn't just for big health to get bigger. You have to have collaboration and work with rural hospitals. Your ER would be overrun if I sent you 30,000 of my ER visits. You would be overrun. You could not meet the capacity today. And so we have to have a collaborative spirit, which you've already spoke to. But I want to get in the weeds because this is all about rural health and talk about what Michigan medicine is doing in collaboration and work with, and how do you reach out to your rural hospitals? And can you give us some examples of where that's been successful?
Yeah, thanks, JJ. Well, I'd start by saying, I would say the resiliency and creativity and commitment of rural hospitals is extraordinary. And my exposure to this has grown exponentially through our partnership with University of Michigan Health Sparrow, as I've rounded, as I mentioned, at Carson City Ionia, Eaton, Clinton. And I think first and foremost, I'll come back to that concept that at a larger academic medical center, like our academic medical center in Ann Arbor, the philosophy should be to how do we provide complementary capabilities? Because at the heart, the rural hospital, rural healthcare system is in and of the community and meeting the needs. And then can we provide adjacent complementary capabilities? And I'll try to give a couple examples of that. I mean,
Please.
the best known now probably is telehealth, right? And from Michigan Medicine in Ann Arbor, we've now, provided nearly 500,000 video visits that we think have saved, on the order of 35 to 40 million miles traveled, really making care more accessible. And in rural counties across the state, probably up to 40,000 video visits even in the last year. But how do we meet particular needs, right? Because behavioral health is an example, and a program that we've elevated and that I'm very proud of, and our Department of Psychiatry has done wonderful work, is called the Michigan Clinical Consultation and Care Program, or MC3. This is a virtual program that offers psychiatry support to outpatient healthcare providers in Michigan who are managing patients with behavioral and mental health concerns. It includes children, adolescents, young adults, and women who are contemplating pregnancy, pregnant, or postpartum. And this program, which is a partnership with the state, JJ, has really been transformative in rural environments to give kind of real-time behavioral health consultation. So kind of classic video visits, the MC3 program has been important, but also I would reference a few specialty programs like our telestroke program that's now providing kind of just-in-time partnerships with emergency departments at 11 hospitals across the state. So these have been examples where, from a clinical delivery system, that capability enhancement to support rural health delivery, because all those patients, the patients receiving those behavioral health consults, the patients receiving those video consults, the patients perhaps getting recommendations for acute stroke care, are getting that care close to home with their families in their community. And so those technologies, should be helping to expand capabilities in more rural environments. And I think we've really worked to focus in that area. I would say the other thing, though, is to kind of identify what some unique needs are and how we might support those. And I'll give one other example, which is the MOPEN program. This is the Michigan Opioid Prescribing Engagement Network. And this is an initiative that's been around for a number of years now that focuses on how do we support evidence-based initiatives across prevention, treatment, recovery, and responsible prescribing practices. And in fact, this is a partnership that started with support and engagement with Blue Cross Blue Shield Michigan's Value Partnership Program, and now includes a grant from the state that helps what I'll call rural medication for opioid use disorder. It's called the MOUD Link Initiative. And this initiative really supports partnerships with rural emergency departments, outpatient practices to help connect patients from the emergency setting to ongoing treatment for opioid use disorder. So I think some of it, JJ, is technologically driven. Some of it is programmatically driven. All of it is focused on ensuring that patients can get as much care as close to home as possible. So when we think of the role of rural health and an academic medical center, it isn't I don't view it as like a focused or a niche issue. It's fundamental for the health of our state. And it's based on the premise that healthcare should be as local as possible and that specialty expertise should be helping build capabilities in communities to the greatest extent that we can achieve that goal.
Yeah, that's powerful. That's very powerful. And the beauty of that is in your relationship is that rural health can be sustained.
Exactly. And
rural health sustainability is critically important because we don't have access to stroke systems. And so having telestroke as an option is critically important to keeping our local hospitals open. So thanks for being the leader in that. We have a few more questions, and we're almost done, and we could talk for hours. We really could. But I want to ask you a question really to get at the heart of what you're dealing with every day. And it's a simple question. What keeps you up at night right now as you think about the challenges that this nation faces in healthcare, that we face in Michigan in healthcare? What do you grapple with that keeps you up?
Yeah, thanks, JJ. And there are many of the issues we've talked about, right?
Yeah.
operations, finance, culture, access. I think fundamentally, JJ, I think a lot, as I know you do, about, I'll come back to that core issue of how do we continue to build, rebuild, elevate trust in our communities, right? With our patients, with the broader communities we serve, with other stakeholders in the healthcare marketplace, because as healthcare systems, there's a lot of finger pointing. The challenge is yours. The challenge is yours. But in fact, the solutions end up sitting, at areas of overlap. And so rebuilding trust and is an area where I think a lot about and sometimes wonder how we can continue to do that at a faster pace.
I would agree with you. All right. In contrast to that, let's talk about some exciting things that are happening. So what has you excited that you're doing right now? Maybe it's a project or two. Maybe it has something to do with collaboration, whatever it is. Could you talk to us a little bit about what you're excited about in the new year, whether it's your new fiscal year, a new program year, or what you're really looking forward to?
Yeah, thanks. I love talking about things that are exciting us. And I'm going to talk about an example that we're actually trying to do across the Academic Medical Center, University of Michigan Health Sparrow, and University of Michigan Health West. And this is what I'm calling our precision oncology program. And JJ, this really, I was rounding in the infusion center in Carson City in the fall, and there were patients there being taken care of by the nurses who'd been working there for almost 40 years. I mean, these are taking care of their neighbors, community members. And and we were talking about in cancer care, the ability to understand the underlying DNA changes, the so-called actionable mutations, and that many patients are not able to receive treatments that would either be more effective or have fewer side effects, or perhaps create access to a clinical trial because the capabilities for sequencing the tumors are not symmetrically available, right? They might be readily available in one academic center, but less available in other sites. And then the ability to interpret those and identify the treatments or trials. So we're implementing a precision oncology initiative that is really seeking to allow as many patients as possible to have their underlying tumor sequenced so that the DNA changes that predict the likelihood of responding to therapy and ultimately longer and better lives can become more widely available. And in an area that is a big part of my career, which is cancer care, I see this as a potentially transformative way of not only improving survival, but creating innovation and kind of the next level of discovery and research across the state. So I'm excited about that one and looking forward and grateful to our teams who are helping move that forward, JJ.
Yeah, you're doing some incredible work. And I mean, Brian Peters said on stage with the governor last week, we're doing God's work, and we truly are doing incredible work, and for all the right reasons. And I'm going to encourage you to continue the great work that you're doing, Dr. Miller, leading a very, very highly respected organization in our nation, and certainly serving as a role model to many of us in rural America of how to bring it all together and make it work. So it's always a pleasure to have thought leaders like you on this radio program to talk and share about the insights that you have and the successes. And hopefully our listeners are able to model some of these to have the same type of success. We're going to drop your information in our show notes, as well as some of the sites that you gave and some of the information. So if there needs to be additional follow-up or research, that our listeners can do that. And before we go, there is one segment that we run on Rural Health Today, and it's really focusing on what we call rural health recommendations, because this is a very unprecedented time in our nation. Leaders right now are rising up, some very new, some very fresh. A lot, if you study Becker's and see a lot of the articles every day, it's healthcare executives are exiting the industry at unprecedented numbers. And a new generation of leaders are stepping up and stepping up in one of the most difficult times that we've ever faced in healthcare because of reimbursement, because of the challenges of insurance negotiations, and the list goes on and on. But you're a wise man, and you have led a significant amount of progress in the state of Michigan and globally. And so I want our listeners to be able to pick a little bit from your brain about, share with us, maybe it's an encouraging word, Maybe it's some sage advice, but we have leaders rising up today that are asking the question. I just took a call last week from a leader across the country who said, how are we going to make it? How do we do this? I'm getting hit with physicians who want more pay. I'm getting hit with staff that need more pay. I'm getting hit with insurance companies that want to pay me less. And then look what HR1 does to us, JJ. And sometimes it's a lot of noise, Dr. Miller. I want us to take a pause right now and for you to give a rural health recommendation. You've been to the rural sites. What can a rural leader today, what advice, encouragement would you give them to keep on keeping on?
Yeah, thanks, JJ. Well, all the things you mentioned are real, and it is a complex moment, and it can at times feel like a really formidable leadership task. But I think, and again, I would say that you've modeled this very well. I think as a rural healthcare leader, a rural healthcare provider, part of the responsibility is to think beyond the four walls of our clinics or our hospital, right? We have to be providing the essential care services, right? And when we talk about those every day, whether it's obstetrics or primary care or behavioral health, right? But to be definitional and foundational for the communities we serve, which rural hospitals and health systems do particularly well, thinking beyond the walls of the hospital and how we can become relevant for all the other aspects of our communities, for many aspects of our communities' lives where maybe we haven't been as present. And you've outlined some of these. There's this concept of primordial care, which is decisions that we make about physical activity, diet, other aspects of healthcare that typically have not been the purview of healthcare systems. Yeah. Perhaps with technology and support from AI, we can help encourage our patients and our community members to understand options and focus on aspects of health even before they walk into the walls of our system. When they're in our systems, we want to provide the highest levels of access and quality. And then we have to think about, as you've said so well, the other aspects of health that require partnership and advocacy outside of the four walls of our clinics and hospitals. Are we supporting transportation? Are we advocating with the state for access to broadband and career development programs for the next generation of our employees? Housing and community partnerships. In rural healthcare, perhaps more than anywhere else, having a view beyond those four walls to being that essential partner is both impactful and challenging, but it is necessary at this moment in time. And then as a broader healthcare system, supporting leaders who are taking that stand in rural environments is going to be important because as you've said, JJ, and as I believe, we're all part of an interconnected ecosystem.
Absolutely we are. Credible insight, very impactful. I'm so grateful for the work that you're doing. And when you advocate as you do, you're not just advocating for Michigan medicine, you're advocating for hospitals like Hillsdale. And I want to just say thank you for that, for the work that you're doing at all levels, whether it's advocacy, R&D, just the incredible work of social determinants of health. Thank you, Dr. Miller, for sharing your insights and being part of our podcast as others around this country get to learn a little bit about the success that you have driven at your hospital system. So thank you for joining us today.
Thank you, JJ. Thank you for the opportunity. It's an honor. Thank you for your leadership, and I hope you have a great rest of the day.
And thanks to our listeners for tuning in to Rural Health Today. Catch our next segment, Rural Health News, to stay up to date on the current state of rural healthcare every Monday, wherever you get your podcasts. Don't forget to check out our latest updates and resources from Rural Health Today at ruralhealthtoday.com. And make sure you subscribe to the show so you never miss an episode. Until next time, remember, Rural Health Strong.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to our guests for sharing their expertise on the show, and also to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.